Hey YouTube. So it's 1 week out from my surgery, and I thought that this would give me a good chance to finally get a video up on YouTube. So I've had scoliosis since, I don't know, I was 10 maybe even longer. When it first started, it wasn't really too bad. But then last October 2015, it was at a 57-degree angle, or 57 degrees. And before that, it had been, not, it was still bad, not as bad, and they had me wear a back brace. And I know that some of you are wearing a back brace now. I don't know if you're wearing a nighttime one or it's an all-day one. Mine was a nighttime back brace. I only wore it at night, and my curve still progressed. So in October, it was 57, 58 degrees, October 2015. And at that point, the surgeon, he mentioned surgery, spinal fusion. And my mom, she didn't want to go through that. And so what she did is she kind of looked for alternatives, and we tried chiropractic care, we tried certain types of physical therapy or yoga, and my degree still progressed. So in May, on Mother's Day actually, because our appointment got postponed, in May we went for a checkup, and my degree had progressed even further to 77 degrees. And at that point, we just kind of knew that we needed to go with the spinal fusion surgery. So, we discussed a date at that time, and the surgeon said July 18th. Now, from April to July, that's quite a few months. And if my degree had progressed, over 6 months, almost 20 degrees, actually, 19, 20 degrees, then a couple more months it could progress even further. So that's what I was worried about. And I just kind of broke down crying because I was at a 77-degree angle, and I had to wait till July to get it fixed. And so the thought of having a 77-degree curve was fine at that point. Now it was just kind of, 77 degrees. So then, I keep saying so then, I'm sorry. It's my first video. Oh. So then, what was it? Last Tuesday, was my pre-op for the surgery. And so we went down to the Cleveland Clinic, main campus, and it was a whole day of just appointments for blood work, and there was an interview of insurance and stuff, and just all kinds of things, checkups and more x-rays, so we would see if it progressed even further. It did! So now my degree, it is at 91. I am basically a right angle plus 1 degree. And so I'm just it's very stressful at times. And I know the mothers whose kids have scoliosis are also very worried about their kids. It's tough. It really is. I mean, I have a very severe curve. I don't know how severe your guys' curves are. But it's tough. I know I keep saying it, but it's tough for me. And 91 degrees, I don't know what having a straight back is like. And I will never truly know, because the surgery is not going to correct it 100% straight, but it's going to be a good 70 to 75% correction. So hopefully it gets into the low 30s, maybe even to the 20s, I'm hoping, because that would be the best. I just want to let all the people out there know, the parents and kids who do have scoliosis, do it as soon as you can. If they mention surgery at that point, you should do it. Because my mom didn't do it, and she feels really guilty now. And I don't want her to feel guilty, but she does. Because we waited since October 2015, and now it's July. And I could have been healed up already, because it takes 6 months to fully recover. And so, just, if they mention surgery, you should do it. Because then you wouldn't be in my situation. And I just want to help all those out there who are thinking about it or pondering about it or searching the internet for it. Because I know that's what my mom did. And she talked to somebody else's mom who had the surgery, and she said that's what she did. So, just, I don't know. This is a week before my surgery, and I'm nervous. And I'm sure as the week goes on, and it's probably going to be a really long week, I'm sure I'll get even more nervous. But that's what's going to happen. And it's going to be weird having a straight spine. It's going to be weird. I'm going to get a little taller, which is good news for me, because, you know, some of my classmates who might be watching this, they're like, do you ever grow? Well, yes, I do grow, but I'm growing this way. I'm growing this way, because my curve starts at the bottom, and my spine is basically in this shoulder blade. Like, I can't even do it like this. My shoulder blade. So, I do grow, just not the right way. And who knows how tall I'd be if I didn't have the scoliosis that I have. But do it. Just get it done as soon as you can. Do your exercises if you do therapy before. Just try and... I don't even know how to word it. I really don't. So hopefully maybe I'll do another video during the week. And if I don't, I will do one before I go into surgery next week on the 18th. So, thank you for watching, and maybe see you next week. Bye.